sometimes see women who actually want breast lift but that they can get it done without any surgical procedures. Normal women, as they undergo pregnancy and post-pregnancy lactation, the breast engorge. So there is stretching of the skin. And then once the lactation is over, during pregnancy lactation and involution also makes the skin very elastic and saggy. So here comes the concept. A sagging breast without any scar, would it look aesthetically better, or a lifted breast with all ideal proportion, would it look better? So women who plan to have or undergo breast lift have lots of doubts with regards to this procedure. This is Dr. Jayanthy Ravindran from Tamira Plastic Surgery. Sometimes see women who actually want breast lift but have this impression that they can get it done without any surgical procedures. You have to understand that lifting the breast means you're lifting a tissue with some weight. Just because an energy device is applied, it will not be able to lift the descended breast tissue. It could tighten the skin to some extent, but cannot lift your descended breast tissue without a surgical procedure. Very important for you to understand what is the concept of breast lift. So, normal women, as they undergo pregnancy and post-pregnancy lactation, the breast engorge. So there is stretching of the skin. And then once the lactation is over, those tissues, actually we call it involute, they shrink. So there is a volume reduction. When there is a volume reduction and with aging, gravity, people add weight, lose weight, the whole breast tissue on your chest wall descends from its original position. Now, along with this, the expansion during pregnancy lactation and involution also makes the skin very elastic and saggy. So, for breast lift, a few important points to consider is the skin has to be shortened or tightened to its original level. Your breast tissue has to be returned to the place where it was originally placed, and also the black area, the nipple areola complex, should be in the center of the mound. Now these are concepts that needs to be achieved, and they cannot be achieved just by using a non-surgical procedure. When you are looking at surgical procedure, you have to understand that you will end up with a scar. Now the challenge is, what are the options that you have? Where can these scar be placed? We as a skin of color, will these scars become thick, hypertrophied? Will it become obvious? So here comes the concept. A sagging breast without any scar, would it look aesthetically better, or a lifted breast with all ideal proportion, would it look better? So this is where a specialist comes into action and explains to you, in your case, which of this would be better. So then you discuss with the specialist regarding what are the options of scar, placement of scar to achieve this ideal result. Sometimes the only option would be what we call a periareola scar, that is around the black area, then a scar extending from that periareola to your underbreast, and also with a small scar on your underbreast. So this could be the only option. But some smaller breast, we could end up with just what we call a lollipop scar, that is a periareola scar and with just a vertical scar. And for even smaller breast, when we are actually replacing a volume and also tightening, we could just get away with just the periareola scar. Nowadays, we also try to add an implant using a scar just in your underbreast, but trying to lift the breast tissue using what we call internal mastopexy. So you try to fix the descended tissue back in its position using internal sutures. But remember, when we do these procedures, you need to have a tightened skin. So if the skin is really in excess, just doing an internal pexy will not give you the ideal proportion. Any of you have been considering a breast lift, please, if you have any further doubt, leave your comments below. and read carefully about all the options. Don't get carried away by influencer videos suggesting that you could do a non-surgical procedure and get the ideal proportion. Yes, there are some non-surgical procedures. Radio frequency can be used, but just to tighten the skin. So, wishing you all seasonal greeting. This is Dr. Jayanthi Ravindran from Tamira Plastic Surgery.